The FDA has given emergency approval for new COVID vaccines for anyone 6 months and older with no clinical trials to show for it. Don't worry, though. They say studies suggest that it's effective. Here to break it down with us is Dr. Peter McCullough, who has long since been critical of the COVID vaccines, and he is here to take a look. Thank you for joining us. Can you provide your reaction and just make it clear, this is not the original monovalent vaccine. This is not the bivalent. This is a brand new thing. So why are we getting so little information about it? What do you think of this?
I'm not recommending them for my patients at all or for family members. These are now monovalent vaccines directed against XBB 1.5 Omicron subvariant strain. That strain now is nearly extinct. It's only 3.1% of all strains out there. The current outbreak is driven by the Eris or EG5 strain, which is most prominent. And what we see is a pattern here where the Pfizer and Moderna are constantly behind. By the time they actually develop the RNA code for a particular subvariant strain, quickly the virus mutates away into another strain. So these are obsolete. There are no studies showing they would ever work against EG5. And to my knowledge, they're not any safer. We'd expect the same safety profiles we've seen with all the prior vaccines.
So I want to talk about the 6-month-olds because they're and this is under the emergency use authorization, Doc, which is, so there's an emergency and among 6-month-olds on up. So are you seeing an emergency of COVID among 6-month-olds?
No, not at all. We're not hearing about it at all in children. Now, I've had some adults with the recent, presumably Eris strains, very mild. It's like a common cold and no fever, no pulmonary involvement. We just use the virucidal nasal sprays and gargles, and they work just fine. Just over-the-counter solutions. Haven't had to prescribe any drugs. We don't believe the hospitalization data are adjudicated, meaning that the hospital started testing people again, and people test positive for many months afterwards. They're not bona fide COVID cases that are winding up in the hospital.
No, in fact, just today, the CDC's data shows that even though positivity test rates are increased, death rates are down almost to an unmeasurable number. So that actually verifies what you just said is high numbers of positive cases do not mean high numbers of serious cases. And we don't have any data to show that this is any more serious, do we?
No, we don't. In fact, the virus has become progressively more mild. That's great. We know a paper from Clayton and colleagues, Harvard, 97% of us have actually been through the virus clinically or subclinically. And so second infections have a zero risk of hospitalization and death, as shown by Chin and colleagues, New England Journal of Medicine, October of 2022. So I don't worry about any of my patients being hospitalized with COVID at this point in time. Every so often I'll get somebody who's never had COVID before. It's completely new to them. And I've had to advise on a case recently where we needed to, give an oral medicine like ivermectin or doxycycline or prednisone, but it's very rare now.
What about this as a pre-existing condition? The idea that if you've had vaccines before, you might now be more open to getting COVID. That you are now somehow, you have less protection. Can you speak about that, which I find unbelievable? You couldn't say this 3 years ago. You would have been outcasted for this.
I know, but all the countries that actually fairly report cases, hospitalizations, deaths by vaccine status, like the UK does, show much higher risks for the vaccinated. So every single vaccine that's taken, there's more and more risk. There was a Cleveland Clinic study by Shretha that showed the same thing. So what's going on is what Wheatley and colleagues predicted in 2021. It's called immune imprinting. The body is being misdirected against antiquated strains. So when the new strain hits, the vaccinated are actually more likely to acquire it and get sicker. Those with no immunity have already faced the virus and against all the components of the virus, are in much better shape to actually, manage an infection if they have it. It's the strangest thing to keep taking shots every 6 months, but yet be more and more prone to having the illness the shots are supposed to prevent.
Strange indeed. In fact, I was going over the fact sheet for each of the vaccines, one approved by Moderna, one approved by Pfizer. Both of them say this exactly under the section, what are the benefits of the vaccine, says the duration of protection against COVID-19 is currently unknown. So they don't know, they didn't test, they don't seem to care, and that leaves open the window. What I get concerned about is it leaves open a window to make you take another one in 4 to 6 months. That's not a question, but you can respond.
But we've never had any type of vaccine where people who are following the narrative right now, they're on their 8th shot. We've never given 8 shots of any type of foreign antigen or a killed vaccine or live attenuated vaccine, let alone 8 injections of a novel genetic code where we don't see any evidence that the genetic code is broken down or disposed of in the human body. It's pseudo-uridinated. It's modified to be very resistant to human ribonucleases. The spike protein seems to have a very, very long duration of time in the body after it's produced by the vaccines. A recent paper by Brogna and colleagues, shocking. They were able to use mass spec and identify the spike protein truly coming from the vaccine because there's a certain signature, amino acid signature profile on it. And that is widely circulating in the body in their study up to over 180 days in about 50% of people who took the shots. That means 50% of people who took the shots walking around out there. Can you imagine every 6 months they take a shot? They'll have continually circulating spike protein. The spike protein we know causes damage to tissues, organs, causes blood clotting and the complications all associated with the vaccines.
Right, which is not any more conjecture because those things you just said are on the facts sheet now. They weren't originally, but they are now at least on these. So you are given this warning, I guess. If that's
it's true. Patients are fairly worn down. The doctors are. There's over 3,400 papers in the peer-reviewed literature on this, over 800 on myocarditis. We have compelling evidence from the autopsy studies, papers by Holscher, colleagues. I'm the senior author. 73.4% of the deaths that occur after the vaccine are truly due to the vaccine. That's now proven. The benefits are very, very limited theoretical conjectures at this point in time with no clinical data on the BA4, BA5 booster. It completely flopped. Now we have none on the XBB 1.5. It's another flop being introduced into the market on the efficacy side. And I think it'll be more continued safety concerns for people who take them. Fortunately, very few people in America are taking them.
Chris Kingdom in our chat says, how can they approve an emergency vaccine if there's no emergency? And then also Red Spartan on our Rumble chat says, can you ask the doctor about shedding? Yeah, how's it an emergency? And can you talk about the shedding?
The emergency use authorization was a mechanism that is completely predicated on having both a national emergency and a public health emergency declared by HHS. So the vaccines are government property issued as military countermeasures, essentially. So when the Biden administration on schedule dropped the overall national emergency and Bashara dropped the public health emergency, we should have been done. We should have been completely done. But FDA Commissioner Rob Califf came out and said, nope, the vaccines are going to continue despite the lack of a national emergency. So here the FDA is just enabling this. The question is, who's giving the FDA these orders? Well, the FDA is supposed to be an independent watchdog. Who's giving the orders? There is great concern, by the way. I'll tackle the second part of this about shedding. Helene Benoon and INSERM, former scientist at INSERM, who's probably the most knowledgeable on this. She's pretty convinced the shedding is occurring both of the messenger RNA as well as the spike protein. Messenger RNA is circulating in the blood at least a month after the shots. Spike protein, widely circulating for 6 months or more. So there's got to be a period of time where people take the shots. They theoretically could shed onto someone else with a lot of contact.
Well, it does seem like the CDC and the FDA are sort of wagging the dog, for lack of a better term, because tomorrow they will meet to decide which populations to recommend. And if they decide that they agree with the FDA, which we have no reason to believe they won't, then taxpayers, the federal government, will pay for these shots. So whether you want it or not personally, American taxpayers will be paying for it. I know I don't want to ask you to ring in on business deals and government corruption, but do you have a reaction to that?
At this point in time, they shouldn't be government property. They should be commercial products. People should buy them. They should sell, should be bought and sold, commercially approved by insurance companies, unless they enter into the marketplace as commercial products like other biopharmaceuticals. This offering of government property that is, many times brought forward under the setting of pressure, coercion, threat of reprisal, mandates, is making people exceedingly uncomfortable. Do you know they are government property in every single country in the world? That's hard to imagine. Three and a half years into the pandemic, that these are still forms of government property. They should be just commercial products. People should decide to purchase them should they want them.
Yeah, as you write in your book, biopharmaceutical complex, just like the military-industrial complex needs to make its money. I'll get you out of here on this, Doctor. You've been gracious with your time. We want to allow you to get back to your patients, which is just turning on television, seeing all of these television doctors that work for like the local NBC affiliates and the local CBS affiliates, and then you have Jean-Pierre at the White House podium and getting up there telling American people, it's getting scary out there. Go out and take these shots. That's the best thing that you can do right now. Mask up. Go get the shots. What do you say to that?
Masks don't work. Many people are now standing up against masks. Many governors, former President Trump, scientifically they don't work. We should forget the masks. But I tell you, the nasal sprays and gargles really work. Everybody should be outfitted with those when they travel. It's good for just general hygiene to avoid common cold, flu anyway. And then the vaccines are not safe, not effective. And we can't tolerate our government officials making false claims. So Jean-Pierre the other day was saying that the vaccines are the best way to stay safe from hospitalization or death. The vaccines have never been shown to reduce hospitalization and death in any prospective double-blind, randomized, placebo-controlled trials, nor in any valid observational studies. Recent paper on the preprint server by Michaels and colleagues that have analyzed all the deaths in the Pfizer dossier that occurred after the data cutoff for the very first meeting on December 10th, 2020 by the FDA, actually showed 38 more deaths, majority with Pfizer. There were actually more deaths with Pfizer the moment they were approved by the EUA, and the FDA missed it, Pfizer missed it or concealed it. And that pattern of excess death, particularly excess cardiovascular death and excess threefold cardiovascular death, that should have actually halted the program right there. Pfizer never should have been approved or on the market.
Dr. Peter McCullough, thank you so much for taking some time out this afternoon there at the hospital. We really, really appreciate it. Thank you so much for your expertise and insight, as always. Thanks, Doc.
Thank you.